Good morning, and welcome to NIC's fifth webinar in our Leadership Huddle series. This morning's discussion will focus on the NIC Bluebook, addressing 5 impacts of COVID-19 on seniors housing and care. I'm Chuck Harry, NIC's Chief Operating Officer, and I'll be facilitating incoming questions for this morning's panelists. Before we begin our discussion, let's review the webinar's technology logistics. You've joined the webinar using either your computer speaker system or your telephone based on your audio access during your most recent GoToWebinar session. You can adjust your audio access to this morning's webinar through either your computer speakers or your telephone using the settings in the audio pane, which is located on the top of the control panel on the right side of your computer screen. We welcome your questions for our panelists during today's webinar. To submit a question, type your question into the questions pane located within the same control panel on the right side of your computer screen. You may submit questions at any time during the webinar, and select incoming questions will be answered following the panelists' discussion. For those questions not answered during the webinar, we will strive to follow up with individual responses following the conclusion of the webinar. For those of you on Twitter, our hashtag for this webinar is #NIC Leadership Huddle. Now that we've addressed the webinar technology logistics, please welcome my associate, Beth Mace, who will introduce this morning's guest speaker and begin our discussion.
Great, thank you, Chuck, and welcome everyone. This is NIC's 5th Leadership Huddle webinar since we started the pandemic. As you know, we've been holding these webinars as a way to keep our friends and people who attend NIC conferences informed of what's going on. I'm pleased today to be joined by Mercedes Kerr, who's the president of Belmont Village Senior Living, and she'll be introducing herself in a moment. Before I introduce her, though, I'd like to just explain a little bit about today's format. You'll see that today's webinar is called the NIC Bluebook, and for those of you who remember the blue books you took in college, those were the opportunities for you to present all the answers to your professor's questions. So this session today is meant to be able to provide you some answers to some questions related to COVID and related to the impact it's having on seniors housing and care. As I start the next slide, I just wanted to point out, for those who don't know, NIC is a not-for-profit 501c3 organization. Our mission is to enable access and choice by providing data analytics and connections that bring together investors and providers. Much of the data that NIC uses in these webinars is based on NIC map data, and you'll see some slides today that I'll be presenting, which will focus on starts and also construction trends. The next slide, as I think most of you know, NIC has been working with ASHA, Argentum, and other associations to really try to make sure that our frontline healthcare workers are supported during this time of crisis in order to keep seniors safe. And we're doing this through trying to prioritize testing for frontline healthcare workers, through increased availability of PPE, and then also to make sure that frontline healthcare workers are able to meet their own personal obligations so that they can in fact get to work. Next slide. You'll know, I think most of you, that we have created since the pandemic a resource center that you can see the link for it at the bottom of this page, and it includes the executive survey insights, which are weekly results of surveys we're conducting among executives to track trends in occupancy, move-ins, and move-outs. The Leadership Huddle webinar series, which we're participating in now. A COVID-19 reach tracker, which is attempting to get a sense of how many skilled nursing and seniors housing properties have been affected by COVID. A regulatory review. A new report that was just issued this week, our intra-quarterly snapshot, which is taking on NIC map data that's usually presented on a quarterly basis, and now we're presenting it on a monthly basis. A lot of relevant blogs, and something that we were doing for a while called Leadership Brain Dates, and they might come back. Next slide is just to show you an outline for today's session. I'm an economist, so I'm going to talk a little bit about the pandemic initially, and then the impacts that's had on the economy. And I believe that there's about 5 direct categories of impact related to COVID and to the economy. And that includes what's happening to residents and frontline workers, operations and market fundamentals, capital availability and its cost, how that's translating into transactional volumes, valuations, and underwriting assumptions, and then construction and development. After we go through those points, I'm going to be talking to Mercedes again about what's ahead, especially as it pertains to healthcare and seniors housing. Now, next slide. And with that introduction, Mercedes, can you let us tell the audience a little bit about yourself and what you do at Belmont Village?
Thank you, Beth. I'm happy to be here, and thank you for hosting this. I think this is a period of a lot of data sharing. It always is, but in particular now, given the unprecedented nature of what we're all going through, I think it's an important time to share best practices and talk to one another. So thank you for inviting me today. So as you probably can see in this slide that you have added here, I have been in this industry now for over 20 years, and I have seen a lot of change. I have really, for the most part in my career, been on the side of the capital and financial partners, and having worked at two of the large healthcare REITs, and have seen tremendous evolution and change in the industry over those 20-something years. I make myself sound maybe older than I should. I'd say it's about 22 years now. And most recently, actually in the fall of 2019, joined, having been with Welltower for 11 years, and having at the end of my tenure there been an executive vice president, I actually left that organization to join Belmont Village Senior Living as their president. And you know, any time I suppose in this industry could be very interesting, but I could have never imagined when I decided to join Belmont Village, you know, what we were about to all go through. And so we'll talk more about that today. But to tell you a little bit about Belmont Village Senior Living, first I should say that maybe it's not a very frequent occurrence when you see people going from the capital provider side of the equation to the operating platforms. In this particular case, I had always been an admirer of Belmont Village Senior Living and what Patricia Will, who's the founder and CEO, had created. But we had also been long-term partners when I was at Welltower, and had a great deal of respect for the platform, the team that had been assembled, the pipeline, sort of the opportunity as this industry continues to change, to be a part of this with such a terrific company. You know, Belmont Village has 31 communities in 7 states, and 1 community is in Mexico City. Really, by and large, these communities were built by Belmont Village and are obviously operated by us. And so there's a great deal of sort of ownership and love for the work that we're doing in these locations that we have selected, which, like I said, are in 7 states, but by and large tend to focus on in California. That is our largest concentration. And the company has properties in under construction still, or in pre-development stages. We have roughly 4,000 or so employees, and roughly 4,000 residents at any given point. So it's a great company, and like I said, I'm happy to be here to talk about it.
Great, thank you, Mercedes. Next slide, please. So just to put things in context, I want to talk a little bit about the severity, breadth, and duration of the pandemic and what we've seen so far. And the next slide puts some statistics together, which shows data from Johns Hopkins. I've had this slide in my presentations for a few weeks now, and actually a month ago, the numbers were quite different, and it's kind of staggering, quite honestly. So a month ago, for global confirmed cases, we were at about 2 million. And as of yesterday, we're at 4.8 million. In terms of confirmed deaths in the US, a month ago, we were at about 35,000, and today we're at 90,000. So the pandemic is here, it's widespread, and it's affecting all of us. On the right side of this chart, you can see the US new cases confirmed. Again, this is from Johns Hopkins. And the curve is flattening and starting to settle down a little bit, but there's still enormous numbers of people that are at risk in this pandemic and that are being affected by it. So Mercedes, with that sort of as background, tell us a little bit about what measures you have put in place for your staff and for your residents to try to prevent the pandemic from affecting them.
Mm-hmm. One thing that has been really fascinating about this process, and I'm sure that anybody who's in operations will have experienced something similar, is that we are continuing to learn about this disease and how it, how it manifests, how it impacts. And so we started very early in March with measures that were mostly guided by the CDC and had to do with screening people where they had been, and certainly trying to identify people who might have been in locations that were known to be impacted, and we were trying to sort of prevent the spread in the United States. I think we realized quickly that that was not going to be enough, and that the virus was actually in the country. And so we very, very quickly sort of stepped up our protocols over time. But it has been sort of an evolution. It's been a process as we learn more. And to the point that we actually, at Belmont Village at least, we voluntarily banned admissions at our communities while we were trying to control the contagion. We certainly have very high, restrictions with respect to access to the buildings. We have a lot of screening tools and some technology even to identify really on a recurring basis, on a daily basis, what our staff and other essential, people who might have access to the building, where they have been coming from, whether they have any risk of being ill. We started out again in small steps, gradually all the way to the point that meals are served in rooms for the most part. Activities and the kinds of physical and social and other types of engagement activities really have modified and have evolved to sort of fit the time and the need, so that we can still have that level of engagement, but we can do it in a socially distant and other safe ways. We have obviously started to use a lot of technology so that, to the extent that people cannot see their loved ones face to face, that they can still be in touch with them. And so a lot of facilitating Zoom and FaceTime and other types of distant, occasions for them to reach out to loved ones, access to telemedicine, which we can talk about a little bit later again. Needless to say, the use of PPE in our communities, everybody wearing masks, certainly having full PPE to the extent that it's necessary if there's a positive case in the community. So the measures are, the list is long. I believe that many are doing similar things in their own communities, perhaps adapted to their own personalities as a culture. But nevertheless, I think mostly what is recommended by CDC guidelines and such.
So Mercedes, I know you at Belmont Village have a lot of memory care units. What are you doing for your memory care residents that might be different from what you're doing for your more assisted living residents?
So in the case of memory care, as an example, you might still have dining in a dining room in some cases. That would not be true to the extent that there's any sort of positive cases in the memory care unit, but to the extent that there aren't, you might still have dining room dining, but in very, very small groups. In other words, you might have shifts in the dining schedule just so that you can accommodate a smaller number of people in the dining room at one given point. You also have to, this is probably true for all, but it's especially true in the case of memory care, is have very particular care with respect to how you communicate with the residents while wearing a mask. So needless to say, when you're wearing a mask, your facial expressions are, and even your ability to be understood as you're speaking out loud might be a little bit different. So a lot of training, believe it or not, just around that, to make sure that we are accommodating or adapting to the fact that, we're dealing with somebody with cognitive impairment that, doesn't see our face while we're trying to talk to them.
Right. Okay. Thank you. That's interesting. I've been getting a lot of questions about the memory care, so that's helpful. Thank you. Next slide. So now we're going to talk a little bit about the economy, and that's the part I really like, because I've been doing economics for a long time. So one way to think about the economy is a storm ahead, and next slide demonstrates that. Pre-COVID, things are looking pretty good. We had the longest expansion that we've had in US history, over 10.5 years long. The unemployment rate was at a 50-year low of 3.5% in February. And, at our last conference in March, we were talking about what could happen that could affect the industry. Well, lo and behold, we didn't expect the pandemic, that's for sure. So on the next slide, you can see the impact of this. This is looking at total jobs in the US economy. And on the far right, you can see that we at peak, right before COVID, we had about 152 million jobs in the US. And in 1 month, month of April, jobs fell by 20 million to about 130 million. Now, this is a really interesting chart because you can see that for some reason, I don't know why, it's the third time in 2 decades that all job growth of the previous cycle has been eliminated. So we were back at the same level of jobs back in February 2010, in August of 2003, and in December of 1999. So this is quite alarming when you look at the impact of that against its historic reference. Now, the next chart, you'll see the unemployment rate. So the unemployment rate, as I had mentioned, had been at a 50-year low in February 2020, and it's now at its highest level since before World War II at 14.7%. It's projected to possibly go as high as 20% when we get the new data from May. This morning, the Labor Department just reported a report on unemployment insurance claims, and today's report showed an increase of about 2.4 million people that were applying for first time for unemployment insurance claims. But since the pandemic started, so in the past 9 weeks, we've seen a total of 38 million people, have filed for unemployment insurance claims. That represents about 25% of the job base. So this is an unprecedented time that we're seeing in the economy, and it's going to bleed over into the next slide, which will be the broader measure of what's going on in the economy called GDP. And this chart goes back to 1968 to show the impact of GDP growth in every quarter. And you can see at the far right, the expectations are that GDP at an annualized rate will drop between 25 and 50% right now in the second quarter. So we're in the second quarter right now. That's April, May, and June. So we're in the thick of it. So possibly, we'll see that most economists are expecting that this is the worst of the times and that we will start to come out of it. But it largely depends on whether we have a second wave and how well we are able to get testing and PPE and tracing, and if we can get a vaccine. And that will largely dictate the impact on the economy, which will then, of course, affect our sector in senior housing as well. The next slide, just to put in, and one more slide, just to put in context, how many seniors are there and what are we talking about? Well, the Census Bureau tracks about 56 million people in America that are older than 65. We generally think of those that are in seniors housing as those people that are over 80, so that's about 13 million people. And of those 13 million people, about 3.1 million are in what we would consider institutional grade seniors housing or skilled nursing. So that would be any properties that are more than 25 units, and that are generally of interest by institutions, pension funds, and other types of investors like that. There are a lot others that are in board and care properties, but I'm not including that. Next slide shows what the impact has been on the seniors housing and care businesses. And this is data that's been was reported in Senior Housing News, but it's analysis that has been done by Asha and Argentum, and I only have the information that was reported in the Senior Housing News. But they look at labor costs, and this data, just as background, is probably at least a month old, so the numbers might be higher than this right now. But even if you had no reported cases of COVID, costs were considered about 8% higher for senior living communities. If you had COVID cases, it's about 18% higher. And this is related to just the staffing and the appreciation pay or the hazard pay that's being paid, as well as the hiring of temp or agency workers and stipends for childcare. In addition, a lot of operators, of course, are incurring costs related to PPE, testing kits, sanitation efforts that are going on within buildings, and then some insurance costs as well. So Mercedes, I'll stop there now. And can you tell us a little bit about what's going on in your properties related to the costs and the financial impact on your business?
Well, I guess I will go in the order that your slide suggests. And with respect to labor, like you said, I mean, it's been not only is it sometimes the stipends for childcare or temp or agency staff, that appreciation pay that you listed, but also, there's obviously a very concerted effort towards trying to contain the contagion. So another cost, which is not necessarily called out, but I know many have been incurring, is the cost of paid leave and quarantine pay, if you will, to the extent that somebody is exhibiting symptoms or otherwise, by the way, a very frequent occurrence, asymptomatic but nevertheless positive. Some of those are not as widely known because in most cases asymptomatics are not being tested yet, but that's starting to change. But a real sort of quick decision to have that person quarantine and sit out and not be at the community. And so paid leave is another category I would add to your list. It has been a sort of all hands on deck effort to make sure that we give the comfort that our staff needs, both by way of the measures that we're taking, such as buying PPE, having protocols in place, taking precautions, but then also just, making sure that we're caring for their needs as well, as you've described, in some cases, even bringing them baskets of goods when, especially in those early days when a lot of the supplies were scarce in the supermarkets. And so just recognizing that our staff was in the building all day, and then going home, just try to help out with, some gifts of groceries and things like that. But, it's been a lot of, on the phone, just talking to them and understanding their concerns and addressing them to make sure that they are really interested and capable, and willing to come back and be every day. So relying on them in trying to make sure that we manage, the need for agency staff has been also an important effort where we have literally just been on the phone one by one, calling people, trying to make sure that we're communicating directly. With respect to the other categories, so PPE, as most know, has been very difficult to come by. We're all, I think, getting into a rhythm, establishing better connections with supply chain, but the cost can probably be all over the map. It really depends on what people had to do in order to get their hands on what they needed to have. So the cost can vary greatly. But with respect to just a full isolation kit for a full day, to the extent that somebody is positive and you're having to don the full PPE, that could be, in our estimation, about $45 a day, just to be able to do, to care for someone who is in full isolation because they have been tested as positive. We have, like you said, even in places where we did not have any incidents of COVID, we have obviously shored up our protocols and had to acquire a PPE. And otherwise, in at least our experience, the difference between a community like that, where we have stepped up our efforts but do not have a positive case, versus a community where you do have a positive case, the cost differential can be, in our estimation, 3 times. So, as soon as you have somebody in your community who is testing positive, the requirements are such that, your cost of caring for that individual, at least as it relates to the COVID, specific cost, can be, can increase very, very quickly. Testing kits, there's a lot of conversation about testing, and we at Belmont Village have access to test kits ourselves, which has been, I think, very powerful. But there is hopefully growing access to those as well, and even in some cases with local departments of health and others attempting to provide some of those supplies.
So Mercedes, in your sort of crystal ball, do you imagine that when we sort of move out of the crisis part of COVID, will this change in terms of like permanent cost structures? Will you have to keep, a certain level of PPE, much like a lot of operators have prepared for hurricanes or tornadoes? Now you have a certain amount of equipment or food or water or generators ready to kick in when needed. So what will be the permanent impact, if any, you think that this will have on your cost structure?
I think everybody in society is going to have to adapt to a new normal. So for sure there will be some new costs. I can also say, though, that I guess the silver lining is that the deeper we are into this, needless to say, the more efficient that we are becoming, not only by way of access to some of these supplies, where we're buying them, if you have more foresight and more planning, just being able to bring the cost down. That is something that is happening pretty quickly too.
Okay. All right. Can we go ahead 2 slides, please? Skip that one yet. So let's talk a bit more about operations and market fundamentals and what we're seeing. So on the next slide, I think most people are aware that we've been conducting this executive survey every week or every other week, and we've had some pretty interesting results. And this slide is showing that in data as of the May 3rd, this is looking at the change in occupancy by care segment. So we're looking at independent living, assisted living, memory care, and nursing care. And on the right, you can see 79% for nursing care. So that's saying that 79% of the respondents in the survey are reporting a decline in occupancy rate in the week ending May 3rd. Less so in memory care and then less so in assisted living. So the lower the acuity level, the less of the impact it's had. Now, some of the drop in nursing care occupancy has also been related to the fact that a lot of elective surgeries haven't taken place in hospitals. So that nursing care, which often serves as a rehab, has also been affected by that in terms of its occupancy rates. The next slide shows the same survey data, but over a longer period of time, and specifically is looking at move-ins. We know that a lot of operators, I don't know if Belmont has, but we know a lot of operators have enacted moratoriums or slowdowns in move-ins. And this chart shows that in the, this looks at the wave 2, 3, 4, and 5. And on the, again, starting on the right for nursing care, the pace of move-ins into nursing care, according to 84% of the respondents, has decelerated. And it's stayed about 84% to 80%. And you've seen a little bit of a pickup in memory care of move-in slowdown, went to 71% in the most recent wave to 34% before that. And then the other IL and AL about 71%. So Mercedes, how has Belmont Village been working with move-in rates that are slowing down? And what impact is that having on your overall occupancy rates?
So I did talk about us having banned admissions for a period of time. We're actually now starting to admit people again, in particular locations where the market is maybe less impacted, if you will. And so we're having some success there. But you know, whereas we banned the move-ins, there were also a lot of respite type of stays and other people who extended their stays with us as well. We are a higher acuity model, so needless to say, we're sometimes in the later stages of life for some of the residents who live with us. And so there's always that dynamic also where people are not necessarily moving out voluntarily, but have simply passed away. And so needless to say, there's an impact to revenue from that perspective. Having said that, there are a lot of people who have been waiting to move in because they do have special needs and would like to be cared for in a suitable environment. And so that's what we're working with right now, are people who had been waiting to be allowed back in. And so we're hopeful that that will start showing in our numbers as well. I would have to believe that it's been a period of impact, just like your survey showed, for a lot of the operators.
So how can you assure residents of the coming in of their safety, or how are you addressing the sort of the move-in patterns?
It's been fascinating. So not only are we working on, for example, having testing before somebody moves in, so that we know exactly what we're dealing with, but just the measures in the building. People move into isolation for some period of time until we can have some certainty that they are not actually COVID positive. We were just having a phone call right before this about other clever ideas to really sort of get back to what I called before the new normal, and have as much interaction with loved ones and with each other in safe environments. So there are going to be new protocols and I think new ways of doing things. So we are performing virtual tours for people who are interested. It's certainly, we can't allow people to walk around the building freely at this time. And that's actually been very well received. We have very specific protocols for if and when somebody moves in, how they can do it, so that we can also minimize that traffic, that foot traffic, as we're trying to move this resident into a period of isolation. Everybody, I think, is very understanding of those restrictions because they realize that they are for their own benefit. And so a tremendous amount of time and effort going into just making sure that we've thought through all of the different, what if scenarios, so that we can, make sure that we address the most, successfully.
Great. Okay, thanks. The next slide. So we're going to switch a little bit. So what we've been talking about up to now is really related to operations. Now, you also had a lot of experience at Welltower, and now in your new role as president, you also have to think about the capital side of things as well. So let's talk about that for a minute. So on the next slide, we're talking about debt market conditions. And I've talked to a lot of lenders, and what I'm hearing generally is that most lenders are on pause for a little while until the picture becomes more clear in terms of the COVID and the pandemic, as well as in terms of the overall economy. Right now, it's a particularly difficult time to really evaluate and price risk. Few originations and limited capacity for new ground-up development. More conservative lending and borrowing approaches by most lenders, with lower loan-to-values, higher debt service coverage ratios being required, typically wider spreads, higher interest reserves that are being required put into escrow accounts. And that's turning into some for distressed asset servicing opportunities and recap opportunities. I know Fannie and Freddie are still open for lending, but their terms have also gotten a little bit more conservative. And going to the next two slides up, if you look at underwriting assumptions, if you're doing a deal or you're thinking about a deal, either for acquisition or for new development, those underwriting assumptions have gotten more conservative as well. In terms of lease-up times, elongated lease-up times, and NOI and margin assumptions, we're thinking that because of the slowdown in move-in rates, there's going to be a slower slower assumptions about occupancies, moderating rents and rent growth, higher expense rates. We've already talked about that, and the cost of borrowing is probably increasing. Questions still about what happens to cap rates. Next slide, and if you look at the transaction volumes, they're very limited today. Extended timelines for a lot of transactions. So if something was supposed to have closed, we'll say in April, it's probably being pushed out to at least a few months until people get a little bit more comfortable in the environment. A lot of capital providers are focusing on their existing portfolios to make sure that they're in sync with the operators and they're making sure they're on the same page. We saw that public markets reacted really quickly with some pretty significant price declines, now some recovery. The private market still has to reprice. And we're finding it's harder to execute a deal because of just physically, because of limited government offices, for example, that are open for inspections or the ability to finalize legal documentations. So that's my take, Mercedes, on what's going on both in the lending market, in a really quick little synopsis, both in the lending market and the capital market. So what's your take from, putting you on your capital markets hat in terms of what's going on in the debt and equity capital markets, and how is Belmont related in responding to that?
Well, I would tell you that with respect to debt, because like I mentioned before, we do still have development projects and other things that are going on, and we've been very fortunate. My sense is that it's probably a relationship type of market, and by that I mean transactions with repeat providers, where there's a great deal of experience already, or projects that we have done together, I think are still possible. I'm not suggesting that the floodgates are open by any stretch, but we have been in the fortunate position of continuing just as planned and securing debt. We haven't had any opportunity to negotiate anything new on the equity side, but just because those deals were already spoken for, if you will. But so we have continued down the path without interruption. But I think that it has to do a lot with, just experience and relationship, having done previous projects together and things of that nature. So I expect that that's true for many, that it'll be very selective in that way, access to capital, that is. With respect to the pricing of capital, you're right. There's a lot of I don't think it's going to be a very long pause, but there's a little bit of a repricing of some things that needs to be taken into account. And I think people are observing all of the different categories that you were describing before. There's one that I would probably have a slightly different opinion to yours, and that is with respect to rate. Given everything we've talked about up to this point, the absolute extraordinary effort that has to go into what we are doing, I don't anticipate that this is an environment for rate cuts and big deals and offers for people to move into communities. And so I believe that there will be, this is not a period of discounting. And so rate, I would maybe different to your anticipation. We'll check back in with each other in a few months and figure out how it really played out. Is not going to be something that you will see go down as far as I can tell. Again, and also in my case, because we have people who have a real need for the services that we are providing, and I think that there's a value proposition that is understood in that. But with respect to bid-ask disparities, they exist always. There's always a lag time in terms of recognizing market conditions. Buyers, financiers being more ready and quick to adapt, arguably the users of that capital being less willing, sellers and users of that capital taking a little bit longer typically to catch up to, and so there's always going to be some sort of bid-ask disparity. But it is, I think you will see less of the type of development that we might have seen in the past with, just what I'm talking about is new entrants to the market, people who are dipping their toe in. I don't think that this is a time to try something new when, in fact, those of us who have been here for so very long are having to adapt so quickly. Just giving one of the things that has been fascinating about all of this is how quickly the guidelines change based on information. And so it's a real Herculean effort to keep up with the changes and the requirements. And by the way, in a lot of instances, having multiple different versions of what is, the path forward, depending on who you ask. If you're, getting some sort of executive order from a governor's office versus something that is coming out of your local Department of Health. So this is not a time, I believe, that those who are not well versed in the space should be attempting to come in, and I don't believe that it's a time when they will be financed by a lot of capital providers. So I think you will see a slowdown in that, which had been a dynamic that was very prominent in the past few years, I think.
Yeah, we had a leadership webinar a few weeks ago with Kathy Sweeney on it from Blue Moon, and she described what she called private equity tourists, who are the guys that were dipping their toes in that are maybe not in the market right now. And certainly when we've been talking to lenders, they've been talking increasingly about the importance of the sponsor and the relationships as well, to make sure that you have people that are experienced in the sector before they get into development, which is a good segue to the next slide, which is related to construction and development. And the next slide shows data that NIC tracks through the NIC Map data service of construction starts. And this is data as of the first quarter of 2020. And if you look at the bottom part of the slide first, it shows that there was a significant slowdown in activity, especially in assisted living starts. They were going into COVID. So there was a slowdown in part because the occupancy rates for assisted living had fallen more sharply than had independent living. So it was deferring capital and investors from assisted living and more into independent living. And at the top, you can see that the starts for independent living were fairly steady. The next slide then looks at starts all the way through to completion, so what we actually call the units under construction. And you can see that same pattern there, that especially in assisted living, that the actual construction activity was starting to wane. So over to you again, Mercedes. What do you think in terms of construction activity? You weighed on a little bit, but you have projects. Are they still underway? Have they been delayed? Will you be doing more projects right now, or what's your view on new development and construction activity?
I do think, like I said, some of the maybe less experienced, some might sit on the sidelines, and I think rightfully they should. We have some projects, and this is maybe a biased view of the world, but we do have projects underway. Like I said at the beginning, we have developed most of what we operate, and so we feel like we have a breadth of experience, a depth of experience that is really going to guide us through this. We've also been through other cycles as a company, so we are actually bullish on the projects that we already have underway. We have very patient capital sitting alongside us that is seeing sort of this bigger picture and expecting, some of the locations that we are in, I should add, tend to be very, very high barrier to entry. So these are projects that traditionally would take several years to really come to fruition. And so patience, I think, in terms of our capital structure is already inherent in what we do. And so those are projects that I believe will continue without any delay. even despite, I think you mentioned in maybe your previous slide, even despite in some cases having some local offices being, working from home, and they're trying to figure out exactly how to create their new cadence with respect to, the whole permitting process. We've been successful in sort of forging ahead and getting done what we need to get done and getting the permits and approvals that we need along the way. This is for some and not for all. I believe this is true for Belmont Village, a time of opportunity. There will be others who might not have patient capital, who might not have the wherewithal to sort of, stand up to some of the delays or challenges that they might experience. And so it could end up being actually a period of opportunity for some who are able to step in and, find opportunities that they might otherwise have not been able to have.
So you refer to markets that have barriers to entry. How does Belmont Village look at a market that would have a barrier to entry? What would be an example of that?
So Belmont Village has really a lot of its properties, most of them in sort of denser locations where it might actually be an infill type of project as opposed to sort of a brand new development in an area that had not been developed before, a greenfield, so, and these are by definition in many cases fraught with a lot of opinions on the neighbors and others around, maybe sometimes zoning and other types of restrictions. They also tend to be, in our cases, very sort of more affluent markets. I will give you as an example. We have a project on Wilshire Boulevard on the west side of Los Angeles, right down that row of high-rise condominium projects where there is no land available for development, and so that what we had to do is take something and sort of recreate it into a Belmont Village. It was part of a church. So, that's what I mean by high barrier to entry. It's just markets where there is no easy to find, easy to, permit, easy to develop type of land.
And then once you get into those markets, there are a few less competition because no one else can get into those markets then.
Well, that's certainly what we're betting on. Yes. And
Right.
I think it does prove out to be the case. I mean, if it takes us 7 years to get a project up and running, it would take that next person to, just as long, if not longer.
Yep, great. All right, next slide, please. All right, so let's talk a little bit about what's ahead. The next slide, you can't get away from the fact we're still all aging. Despite the COVID, we're still all aging. And there's, a wave of baby boomers that we keep talking about that are coming. And the next slide demonstrates that by looking at the birth rates, starting in 1909 on the left all the way through today. And in the middle, you'll see I have an arrow that says today's 82-year-old was born in 1938. And that's the wave of people that we're talking about, because as you can see, that slope of those births keeps getting bigger. But the baby boomers don't actually come until about 2028. But there are these enormous amount of demographics that are behind the sector. And the value proposition still in seniors housing is rather strong in terms of care needs, in terms of help with ADLs, in terms of prevention of social isolation and socialization. So I think a lot of those propositions are still there. But one specific one that is getting more play on the next slide is really what determines health. And what we found, this is analysis from Kaiser Family Foundation, and what it shows is that the largest determinants of health is not the clinical care itself, and it's not even your genes. It's really your individual behavior and social environmental factors. And seniors housing offers through population health management, this through offerings that it provides help for adherence to your care plan, medications that you're supposed to be taking, diet and exercise, stress management programs. And what I want to ask you, Mercedes, is what is Belmont Village's view on the emergence of healthcare more into seniors housing than what was, we'll say, even 8 or 9 years ago? I know you guys have usually had a nurse on staff 24/7. You were sort of ahead of the curve on that. Can you comment a little bit on that?
Yes, I would love to, because it's, I think, a really great topic and something that we should all be very aware of. What role do we play in this continuum of care? So look, I can tell you a number of things that we are doing, and then I will talk just for a quick minute about some of the things that I think will be pushed forward by this pandemic. we at Belmont Village work with a handful of institutions. Some of them are academic medical centers. Some of them are, just research type universities. And we do it with different objectives in mind. As an example, we might work with UCSF on protocols, and we've been very directly involved with them, even in vetting and expanding the protocols that we have been using with for this pandemic, because it has required us to step up, if you will. Even in our case, where we have nurses on staff, it has really required us to step up in our ability to provide, a form of care. And so making sure that we have that information and those perspectives. USC, we work with them on matters of leadership and longevity through their USC Davis School of Gerontology. Baptist Health, in Florida, we're working with them on senior wellness type programs. Vanderbilt on memory care research, physical rehabilitation with Memorial. There's just a long list of those kinds of connections, because, we understand that we have the opportunity to impact wellness, and I think that is really, at the end of the day, a large component of what is on your slide is, behavioral, items and social cognitive kind of engagement, home and family, all these kinds of different components that you're describing in this graph. Really, we have an ability to influence many of them to create a better outcome and to enhance, the determinants of health and the kinds of conditions that these seniors live in. And so we are, I think, connected on a lot of different levels. But now, through the whole COVID situation, one of the things that has, sometimes crisis breeds innovation, if you will. And there are many things that we have adapted and amended, and what we do that will endure, and I think will certainly be a new way of providing services going forward. And one of them is telemedicine. So when you think about how we connect with providers, I think that is really going to have a tremendous impact for the better in sort of our ability to provide services and our ability to keep our population well, and to address their needs more readily. So, telemedicine has been, I think, from the very beginning of this pandemic, has been an important topic for us. We've been working on a number of different initiatives, and so you're going to start seeing some of those types of, I think, interactions, if you will, that will flow more freely, where we represent where people live, and these providers want to, in many cases, meet their consumer, their patients, where they live. And so this in our case is in our senior housing communities.
Great, thank you. All right, so I want to leave time for questions from the audience, but before I do that, I want to give you a chance to sort of any final comments that you want to share with us, or largest challenges or lessons learned, or what would you like us to know that we haven't talked about yet?
Well, if I had a parting thought, it would be to recognize the staff, not just at Belmont Village, but every one of the operators who is dealing with this and has had to step up, and also the operating companies who I think are really carrying out the work that is being done. The anecdotes that you hear about are really noteworthy, and this is a different version of being in the front lines, maybe not as often thought about. People think about frontline healthcare workers as hospital, maybe, workers, which, of course they are in recognition, but there's a lot of really good work being done, and I just wanted to recognize that.
Yeah, I totally agree. I mean, I've talked to a number of operators, and the cooperation between operators has been quite remarkable. People that were companies that were once competitors reaching out and helping each other, and then the cooperation also we're all in this together between capital providers, lenders, and operators. I know, so everyone really has stepped up. So it's been pretty amazing to watch, and it's made me really proud to be part of the sector, actually. All right, Chuck, do we have some questions from the audience?
We do, and we have quite a variety of questions. Let's start, Mercedes, where you ended, in speaking to the importance of staff. We've got a couple questions along those lines. One asking if Belmont Village is actually providing staff with so-called appreciation pay, and if so, how long would you anticipate continuing that practice? And then there was a bit of discussion regarding testing, but very much focused on the residents, and curious as to whether you are likewise testing staff, and is there any assumption that staff is positive and therefore providing PPE accordingly for staff?
So to take the first question, this is a sort of on an ad hoc kind of basis. There have been some instances of hero pay, the so-called hero pay. It's not, necessarily a sort of something that we're providing across the board. Part of the reason is that we have a lot of other benefits and other ways that we are supporting our staff, including, we have a fund that provides for them to the extent that there are any hardships. Like I said before, we might be providing them with supplies for home and supporting them, at home as well. So there are a lot of ways that we're recognizing our staff. It's not necessarily only by virtue of hero pay, but in those cases where we have used it, it has been very specific to circumstances as opposed to broad-based.
Okay.
And with respect to the question on testing, we could have 3 sessions like this on testing and we would not be done. And there's new information about it just about every day. And the part of the conundrum I really think has been the fact that testing supplies have not been broadly available. They certainly haven't been available, in sort of equal measure for every operator. And so that there is, even in some of the information that we try to gather about this as an industry, there's just a lot of gaps simply because we're not looking at sort of an evenly distributed, opportunity to test. The early recommendations by CDC and frankly local departments of health was to only ever test symptomatic people. So early days, the testing was really restricted to that, and it had to do with everything that you can think of, such as, making sure that we didn't overwhelm the system and delay the receipt of results and things of that nature. That has started to relax a little bit, and there's now more. This is frankly in some cases by state, sometimes by local jurisdiction, maybe a more of a drive toward testing all members of a community, that is both staff and residents. And having, in some cases, do it all in a single day as to establish a baseline, if you will. Some of that, for example, they talk about it in Tennessee, that is happening, although skilled nursing is being prioritized before assisted living. Some people might have heard of areas where the National Guard comes in and provides testing capabilities. So it's a little bit all over the board. But with respect to Belmont Village, we do have access to test kits, like I said before. And so we have tested our residents first and foremost, and in some cases also our staff. I can't tell you that it's uniform right now, and it has very much to do with local requirements and local guidelines. But I think that over time that will be a trend. I think there's a tremendous amount of anxiety and questions about how frequently people should test, simply because the idea of testing, every other week or even more frequently in the case of New York is, probably not long-term sustainable, if for no other reason by way of cost. And so, there's a lot of debate happening right now as to what is truly, and by the way, very, very important concern is that, a test, I'm afraid a test only tells us in this moment in time you are negative or you're positive, but it doesn't, even if you test negative, it doesn't really go on to say, by the way, if you stop at the supermarket on your way home today after having the test, whether you're going to be, negative again tomorrow. So there's a lot of conundrum and a lot of, confounding issues related to testing.
Absolutely. One question is addressing the recognition that so much of the current messaging is being controlled by the nightly news, so to speak, and asking what impact have you seen in terms of consumer sentiment given that context?
You know, we have been very fortunate. I can tell you that one of the very important protocols that has been in place for us from day one has been a very clear, transparent, and frequent communication with our staff, residents, and their loved ones. And nothing can replace that. And so I guess I'm fortunate to say that really the people that we are attached to so closely and who have witnessed the sort of efforts that we are taking on and everything that we are doing have been largely very, very appreciative and very supportive. And so, we continue to, work on that every single day. So the people who live with us, I think, by and large, seem to be quite understanding and satisfied. It's going to be fascinating as we open our doors again and people's loved ones want to just come back rushing in to see our residents, and we are trying to figure out how to accommodate that in the most, I guess we have to be so careful not to start something new by just, this is not going to be, unfortunately, at least for the time being, free access to our communities. We simply are not going to be able to do that. But my point is that there's a lot of understanding and people willing to work with us and recognizing what is going on because they see the news. With respect to prospects and people who are not yet living with us, we continue to have interest and we answer a lot of questions. I don't know that there is some sort of permanent damage, on the contrary, because I think people who are closer to us understand the specifics as opposed to just being guided by the headlines. But time will tell, Chuck. We'll hopefully be doing this right and we'll earn that trust.
And then just to wrap up, a number of folks are curious as to whether your projects in your pipeline, construction pipeline, have diminished as a result of COVID or not.
No, I was mentioning before, on the contrary, we who knows, we might end up looking at something new and different, but we're in a fortunate position that no, our projects have not diminished. I think our capital partners have been very supportive. I know, Beth, in some of your questions, there was something in there about what do capital partners say about all this. Having been on the other side of this, I always used to say, hey, not everybody's money is equally as green. And what I used to say that as a joke almost. And what I meant by that is that, yes, you can look at capital, cost of capital, and some of those sort of metrics when trying to decide who to partner with. But at the end of the day, what might matter most is what happens in a time of crisis such as this. And I'm proud to say that our capital partners have been very supportive. Not only that, but they have gone out of their way in many cases. As for example, Welltower is actually has a task force trying to help all of us secure PPE. Harrison Street is our partner as well, has been sending a lot of information about technology. Blue Moon, really recognizing that in some cases hero pay is necessary. So, it really kind of boils down to how are your capital partners going to react and support you in a time of need. And so the same is true for new development. I think we have, like I said before, patient capital who are looking at the bigger picture, who, are able to look out in the horizon and recognize that these are projects that are worth having.
Great. Thanks, Mercedes. Thanks, Beth. Beth, maybe we can go to the finals, or Nikki, go to the final slide. We welcome you to join us for our next Leadership Huddle webinar, which will focus on a conversation with brokers during a pandemic. That webinar is scheduled for 2 weeks from today on Thursday, June 2nd at 11 a.m. Eastern. To register for this upcoming event and for ready access to a variety of pandemic-related market information, please visit the NIC COVID-19 Resource Center at nic.org, which Beth overviewed at the beginning of the webinar. From the Resource Center, I encourage you to access our NIC Notes blog, where you can find the blog released just this morning from NIC President Brian Jaruka, speaking to the importance of accurate, consistent, and timely data, which can provide a rare opportunity to build trust. As NIC remains committed to continually improving these webinars, we very much encourage your candid feedback. Please complete the survey you'll receive following the conclusion of this webinar. Within the next 24 to 48 hours, you'll receive an email with a link to download the presentation and view a recording of today's webinar. On behalf of NIC, Mercedes Kerr, Beth Mace, and myself, thank you for having joined us. Please stay safe, maintain your physical distance, but stay connected. This concludes today's webinar.
Great. Thanks, Mercedes.